panic attacks can be really scary, and dealing with them can seem impossible. However, they're not dangerous, and learning some simple, straightforward skills can markedly reduce both the duration and severity of panic attacks. The thing is, learning to effectively deal with panic attacks can be counterintuitive. What seems helpful can actually make things worse. If you are the fastest runner in the world, but you're running in the wrong direction, you're not going to win the race. We're going to go over a variety of skills today, and these skills are going to be useful for other people with anxiety. Frankly, they'll be useful for almost anybody, but particularly for those with panic attacks. Right now, I'm in a branch of Sansum Clinic. Sansum is the oldest and largest nonprofit outpatient healthcare provider on the California Central Coast. My name is Jay Winter. For the past 26 years, I've been both a family physician at Sansum, and I've also taught their stress reduction classes. Over those years, I've helped thousands of people deal with stress and anxiety. I'm also clinical assistant professor of family medicine for USC, former chairman of the Department of Family Medicine for Santa Barbara Cottage Hospital, and author of the book, Relaxation on the Run. Let's start by talking about some possible symptoms of panic attacks and why people have those symptoms. The first thing with panic is people get a burst of adrenaline. Sometimes it seems like out of the blue. Their heart may pound fast or hard. They can feel shaky or get trembling or sweating. People may also feel hot or cold. There may be nausea or abdominal discomfort. Perhaps this is from the blood being deviated from the intestines to their muscles so they can respond to what's called the fight or flight response that this adrenaline causes. Some people may feel like they're choking. Some of the symptoms of panic are from hyperventilation or breathing really fast. Particularly, people may breathe fast using their chest muscles, like this. You can tell that looks kind of anxious when I breathe that way. And if I breathe that way long enough, my chest will probably be sore and painful. So some people with panic do get some chest discomfort. Also, breathing really fast, it changes the acid-base balance of the blood. And that can cause some tingling of the hands or the mouth, particularly around the mouth. The change in the acid-base balance of the blood can make some people feel dizzy or lightheaded. They may feel detached or like they're not real. It can feel really weird. People can feel like they're dying or going crazy. When people breathe too fast, their brains may signal them or signal their bodies to slow down the breathing, and they can interpret that signal as not getting enough air. Keep in mind that the hyperventilation often does not look near as obvious as how I demonstrated it in this video. Nevertheless, the symptoms can be the same. Now, it's very helpful that you and your healthcare practitioner are confident that your issue is indeed panic attacks. Your doctor may or may not recommend blood tests or other studies. For instance, your doctor might order a thyroid blood test to make sure your thyroid hormone level is not too high or contributing to your anxiety. The final diagnosis is really between you and your doctor. But here are some general guidelines. We mentioned that one of the issues with panic attacks is, for a lot of folks, is that their heart can beat really fast or really hard. If the heart rate is going around 50 or 100 beats per minute at rest, then that's pretty reassuring that uncomfortable sensation of palpitations may be from anxiety. But let's say you're just sitting there and your heart suddenly goes to 140 beats per minute or even 120 beats per minute. That's a problem. That's an issue that may be something else besides panic attacks, and certainly something to talk to your doctor about. If your pulse is pretty regular or may have one extra beat here and there, usually not a worry. But if there's no rhythm, if it's totally irregular, again, that could be something else. If you have trouble breathing, but then you go for a 1-mile run and feel better, then that's kind of reassuring. But if you have trouble breathing and you can't walk up the stairs, or your trouble breathing gets much worse when you exert yourself or you go for a walk, that is more concerning for another possible diagnosis. We mentioned neurologic symptoms such as the tingling around the mouth, the tingling at the fingertips. If you get that, and it's just when you're anxious, better when the anxiety goes away, that's reassuring. But let's say you get weakness or numbness of one extremity, or loss of vision in an eye, or drooping on one side of the face. That's much more concerning. And if you suddenly get that, you should call your doctor right away. And also, if whatever symptoms you're having don't go away, when the anxiety gets better, when the panic gets better, that's also some issue you probably want to talk to your doctor about. Here's the bottom line. Check with your healthcare provider and get your questions answered till you feel comfortable with the diagnosis.
Certainly, you should talk with a health professional if you're having any chest pain, fainting, severe pain of any sort, thoughts of hurting yourself, or if you're unclear about your diagnosis.
Sometimes just learning that the problem is panic and not something more dangerous like a heart attack is enough to allow one to relax. But other times, some simple ideas and techniques can be extremely helpful. In fact, some of these techniques are useful for almost anybody, even if they don't have panic attacks. The first hint we're going to talk about has something to do with this. Now let's go to a more relaxing venue to discuss those techniques. You might recognize this. This is a Chinese finger trap. And it's quite interesting in that when you put both fingers in, the more you resist the trap, the tighter it gets. What a perfect analogy for anxiety and panic. Because the more we resist anxiety, the more we resist panic, the worse it gets. You might be wondering why I got 4 of these Chinese finger traps. Well, one thing is they came in quantities of over 4, so that's what I could get, and it was cheaper to get them that way, but there was one other reason. The other reason is because I can really break down how we resist our anxiety to really make a point. You see, one of the ways we resist our panic is we resist the physical sensations. We say to ourselves, I wish my heart would slow down, this feels awful, or my neck is tight, I hate the feeling, and we just feel worse and worse. What's the next way we resist? We resist the emotion. So we say to ourselves, I hate having panic attacks, this is awful, I wish it would go away. And then it's even worse with how that happens. The third thing we resist is we resist the circumstances. What I mean by that is, let's say we associate our panic to happening when we're driving a certain location, or in an elevator, or with a certain office at work. And then we say, oh, I just hate this, I wish I wasn't in this place, or I wish this wasn't the way it was. And then again, it gets worse and it gets worse. There's one more way that we resist what's going on with us and making the panic worse. And the final way is resisting your thoughts. What I mean by that is you might say to yourself, you know what, I wish that I had a clear mind, I didn't have all these racing thoughts, I wish I wasn't going through this, that kind of thing. And then again, with all 4 of them together, the panic just keeps getting worse and worse. Without this Chinese finger trap type of effect, there might just be a little blip of anxiety, and that would come and go, no big deal. But when this comes into play, there's these vicious cycles happening, and these vicious cycles just make things worse and worse. So let's think about a way, how can we deal with this resistance? Well, you've heard about resistance training. That's something else. Resistance training is when people take some weights. Maybe they take a dumbbell like this and they lift it up and they keep using it in one arm and the other, trying to get stronger. The more they lift, it builds their muscles. And that's a good way to get stronger and build their muscles. But that's not what we need here. We already have a lot of resistance. What we need here is non-resistance training. So let me give you another analogy about that. There are, not far from where I live, there are these huge eucalyptus trees that just, boom, fell over in the wind. They were strong. They could really resist the wind, but they couldn't resist it enough. On the other hand, there were some, in that same time, there was this area of bamboo, and the bamboo would grow up really strong, but be relatively thin, but it didn't blow down in that windstorm. And why not? It's because the bamboo would bend. They could do some non-resistance, so to speak. And what we actually want to train in for panic is training in non-resistance, doing some non-resistance training. We'll talk about how to deal with each of these 4 areas of resistance, and I'll take you through an exercise so you can really get some experience with what I term non-resistance training. First though, let's talk a little bit about breathing. Because remember with panic, when people are panicked, they breathe really fast and they breathe up in their chest like this. So that tends to make the panic worse, and we talked about that. What we want to talk about is a different way of breathing, what we call diaphragmatic breathing. The diaphragm is the muscle that goes between the chest and the abdomen. It's a dome-shaped muscle. When a dome-shaped muscle contracts, it flattens out. So if this muscle is flattening out, then, and so I can expand the bottom of my lungs, I have a bunch of organs in my abdomen. They have to go somewhere, so your abdomen has to expand when you're doing diaphragmatic breathing. So when we breathe through the diaphragm, it's feeling the abdomen, and I'm going to demonstrate it. It's feeling the abdomen expand with the inhalation and go back with the exhalation. Now compare that way of breathing and how that looks to most people relatively relaxed compared to when I don't let myself use my diaphragm and I'm breathing like this. That's more like a panic attack type breathing, and that's when people get stressed out. The interesting thing, when I'm speaking to somebody and counseling them on diaphragmatic breathing, they'll often say, okay, I'll breathe using my diaphragm, but they're still not using their diaphragm very much. Their abdomen isn't really going out much. So when you first learn diaphragmatic breathing, you really probably have to exaggerate that sensation of expansion of the abdomen. So right now, I want you to just feel your abdomen and really push it out as much as you can as you take a breath in. Your lungs may expand as well, and that's fine, but I really want the sensation of feeling that abdomen expand. So keep trying a few more diaphragmatic breaths. Some people I've noticed when they work on diaphragmatic breathing have an easier time learning to do it when they're lying down. So you can try that, just going like this, lie down a little bit, and then again practice a few more breaths, feeling your abdomen expand. And keep working on the diaphragmatic breathing for the next few minutes of the video. As we do that, I just tell you a little story that is applicable. I went to a physical therapist, and as part of a study, they evaluated my posture, which I thought was fine. But they had a way of, well, I guess you would say really insulting my posture. They would say this or that was wrong. Particularly my shoulders were too far forward, because I guess I had the habit of walking around like this with my shoulders kind of forward. And when they first instructed me on having better posture and I try it, I'd bring my shoulders back in a better way. It felt so weird to me. But after even a day of it, it felt much more natural. The same thing with diaphragmatic breathing. It might feel a little weird right now, but continue working with it and it will feel more natural. Whenever you find that your breathing is up in your chest, don't give yourself a hard time. Just gently focus back on the diaphragmatic breathing and actually feeling the sensation of the abdomen expanding with each breath. So now I'm going to go over those what I term non-resistance concepts, and then we'll do the exercise. As far as the concepts go, remember one of the things people resist is the physical sensation. So if your heart's racing, your abdomen's tight, you're starting to feel uncomfortable, just see for now, you can tell yourself it's okay to feel how you're feeling. You've already had your healthcare provider tell you that there's nothing serious or at least dangerous going on. So just accept the feeling, not that you'll feel that way forever, but for now, just say, it's okay that I feel that way from now. Let my heart race as fast as it wants to go. I'll do my diaphragmatic breathing. If my neck is a little tight, I'll just allow the muscles to feel that way and maybe soften around that area. As far as emotions, this is important. Instead of saying, I'm too anxious and panicked. Well, anybody is going to resist that. But instead, can you tell yourself, I have a high energy level, or I have an energy burst, and just feel that energy flow through your veins. Keep in mind that the same adrenaline response that we have with panic is the adrenaline on a different scale, but the adrenaline that we feel when we're excited about something, when we win an award, when we're going to go on a ride on a roller coaster. We just got a new car, whatever it is. It's that feeling of excitement. We have that same adrenaline, but we haven't had a chance to say, I hate how this feels, I wish it would go away, and get into that whole vicious cycle response. So what I want you to do, as soon as you feel that burst of adrenaline, you say, great, I have an energy burst. And then just feel the energy flowing through your veins. Sometimes it's helpful to have an analogy. That might be, depending on your era, thinking about yourself as a some sort of superhero, the Hulk, Wonder Woman, Popeye, Tarzan, whoever, just feeling that energy flow through your veins. Almost analogous if you like some sorts of music where the music's kind of mellow and then the beat drops and boom, you just kind of feel it flow through your veins. Then there was the circumstances. When you find yourself thinking, oh, I hate my current job or this or that, see if you can just, you might even plan to change the future, but for right now, accept the present as it is, because you realize the present can only be as it is. So accept that as it is, let thoughts go, thinking that it should be different, and talking about thoughts. When you have any of those thoughts, I need peace of mind, I wish I could stop all these thoughts, I hate what's going on, just learn to notice the thoughts without believing all your thoughts or resisting all your thoughts. So you just notice the thoughts come and go. Now, pick out, for this exercise we're going to do, pick out maybe one or two thoughts, even just one thought that tends to be associated with your panic. Typical thoughts are, I hate how I'm feeling, I wish my heart would slow down, I wish I felt normal again, what if I have cancer, I'm going to die, I'm going to go crazy, all kind of these thoughts. Just pick out one for you, and we're going to use it later in the exercise. So what I'd like you to do to start the exercise is just start with focusing on one breath. Close your eyes and feel your abdomen expand with the inhalation and relax with the exhalation. One breath at a time. Expand with the inhalation and relax with the exhalation. Now, as you do this exercise, your mind's going to wander. You'll have thoughts coming into your mind. That's normal. That's part of the exercise. But as soon as you notice that your mind's wandered, just notice it as a thought, and without giving yourself a hard time, just return yourself to enjoy that next breath. Just luxuriating this next breath. Inhalation and exhalation. Just feeling the abdomen expanding and then relaxing. You may have some physical sensations. If you have any physical sensations for now, just see if you can allow them to be there. Not forever, but just now, saying that it's okay to feel how you're feeling. I don't think you're going to have one of those energy bursts during this exercise, but if you did, just enjoy it and say it's okay and feel it flow through your veins. If you notice any sounds during the exercise, just have the sound be a signal for you to go deeper into your relaxation. And again, return yourself to enjoy the full inhalation and exhalation. Again, the inhalation and the exhalation. Now I'd like you to bring your attention to your feet and see if you can allow the muscles in your feet to soften and relax. Allow your lower legs to relax. Allow your thighs to get heavy. If you have trouble relaxing a muscle group, just bring your attention there. That's fine. Relax the muscles in your back. Relax your chest, your shoulders. Have your arms relax. Have your hands get heavy. Let your neck soften. Relax your jaw. Let your face muscles soften. Even soften the little muscles in between your eyes. And now go ahead and just feel your whole body breathing. Just enjoy the sensation of your whole body taking a breath. Now, in addition to your own thoughts that you may have had during the exercise, I'm going to suggest some thoughts, some things to say to yourself. Both an interesting instruction. Before you say a particular thought, I'm going to have you have the instruction not to believe the thought and not to resist the thought. So just say some silly thing, say the words, and then without believing it, have the words come and go and focus back on enjoying the next breath. The first thought I'm going to have you say to yourself, again without believing it, without resisting it, just say to yourself, I wish my heart would slow down. Say it, let the thought go, and now focus on a breath. Relax your shoulders, relax your chest. If for some reason you feel your heartbeat, just allow it to do what it's doing without resisting it. Enjoy another breath. Now, without believing it, just say to yourself this next thought, I can't stand this. Say it to yourself, I can't stand this. The thought comes and goes, and just focus on enjoying the very next breath. Again, abdomen expands with each breath, neck muscles relax, jaw muscles relax. Again, without believing it, say to yourself, I'm going crazy. Say the thought, let the thought go, and luxuriate in the next breath, just really enjoying the inhalation and the exhalation. Let the back muscles relax. Let the neck muscles relax. The shoulders and arms get very heavy. Now, if you thought of one of those thoughts before the exercise, you may have come up with a thought that is associated with your anxiety. If you have one of those thoughts, you'll use that next. Or if you didn't think of one, you can just use the thought, I'm going crazy again. So say that thought to yourself without believing it, and let the thought just float by like a cloud floating overhead and just go by, and then just enjoy the breath. Relax your jaw, relax your neck, and your shoulders, and your face. And maybe even have a little half smile on your face as you enjoy the next breath. In a little bit, I will ask you to open your eyes, not quite yet, but when you do, keep focusing on enjoying one breath at a time. When you open your eyes, you're going to be more relaxed and feel peaceful. And when you're ready, allow your eyes to open. Now, what's interesting about this exercise is most people finish and feel much more relaxed. Why that's interesting is they've gone through thoughts that are often associated with their panic attacks. If I see somebody in the office, I'll go through maybe 5 of their thoughts that tend to be associated with their panic attacks, but they don't get a panic attack. They feel more relaxed. And it teaches them that it's not the thoughts themselves that create the anxiety and the panic. It's believing the thought, or resisting the thought, or resisting how they're feeling. So learning just to not resist, just notice the thought come and go without any resistance, without believing the thought, and without resisting how your body feels, can let you be more relaxed. So the one other thing I want to say is we don't want to do any of these exercises, even if you're taking one diaphragmatic breath during the day. You don't want to say, oh, I'm going to try this one and then check right away if your panic is better. Okay, I'm going to do one breath. Oh no, I'm still panicked. You don't want to do it that way. You just want to follow the instructions and just breathe the fully getting into and fully feeling the sensation of one breath and then another breath. Another thing with panic and anxiety is just having a good general lifestyle. That means having a good healthy diet, getting regular exercise, having a balanced life, not overdoing the caffeine or alcohol, getting enough sleep, avoiding recreational drug use, and avoid overusing alcohol. If you're being seen by a physician or another healthcare provider, make sure that before you leave an appointment, you're really comfortable with whatever diagnosis they think you have. If they've done any lab tests or other evaluations, make sure you understand everything and get all your questions answered. If you do that, you'll feel more comfortable being able to be assured that what you're dealing with is panic, and you'll know how to deal with it. What you might want to do if you still have issues with anxiety or panic is see a counselor, and particularly a counselor who specializes in treating anxiety, including cognitive behavioral therapy or CBT, exposure therapy, and mindfulness-based therapies. There are classes on stress reduction. One of the most well-researched classes is one that's called mindfulness-based stress reduction. It's offered throughout the world, actually. It is pretty time intensive, so it is an 8-week class, about 2.5 hours a class, but you can look up in your area if they have a mindfulness-based stress reduction. I teach another stress reduction class in Santa Barbara. You can check in with your primary care provider. This can be particularly important if you are thinking about that your panic is bad enough that you want to use some medication, or if you're not sure that it's a panic. So check in with your primary care provider. If you're interested in medication, probably one of the more common medications that they use are the antidepressants. It'll take about a month to kick in. You take it daily, and usually people try it for about a year and see so that they can see how things improved after that course of therapy. If the situation's complicated as far as medications, psychiatrists can be helpful. Once in a while, doctors will use medication called benzodiazepines. We don't try to use those a lot because they can cause addiction, they can cause dependence and sedation. So we try to limit their use. Once in a while, it's good for people to just have a few of them because they act quite quickly, so they know that I have it just in case something comes up, and maybe just having them reassures them. So those are some of the resources that you can use. If you do go to a counselor, then there's, again, the 3 types of things we talked about. One of them was mindfulness, and mindfulness is really just fully paying attention, non-judgmentally, to what's going on right now. For instance, feeling the sensation of your abdomen expanding with a diaphragmatic breath. That would be an example of being mindful. Feeling your feet on the ground with each footstep. Really smelling the aroma of your food, enjoying it, enjoying the taste of your food. If you're outside in nature, enjoying the sights and the sounds of the environment. One of the other things we talked about is cognitive behavioral therapy. or CBT. There, one of the examples is just how we talked about noticing your thoughts coming and going without resisting or believing them. That is probably more what we call MBCT, or mindfulness-based cognitive therapy. Some people a lot of us have incorrect beliefs, and we might think to ourselves, I can't do anything right. And we want to catch ourselves thinking that and realize that that we were saying it first of all, and that we all, but that's obviously not true. We all make mistakes, but certainly not doing anything right is not a true statement. And instead of a heart racing always meaning a heart attack, you can realize that often for people, heart racing is associated with panic. Another thing, or another part of cognitive behavioral therapy, is reframing. Reframing is looking at something another way. For instance, a failure can be seen as opposed to I'm no good, it's a failure. You can say, well, I didn't do something right one time, but now I have an opportunity to learn, to do something better the next time. Another thing you can do is if you're feeling and starting to say, I'm having a panic attack, this is awful, you can reframe that as an energy burst so you're less likely to resist it. Then with yourself or with a therapist, you can work on exposure. That's really assuming the attitude of challenging yourself to experience anxiety-producing situations instead of avoiding them. If we avoid them all the time, they can control our lives. The more you avoid a situation, the more potential there is for that situation for anxiety. Anxiety can build in mythic proportions, and on the other hand, the more you experience a situation, you get used to it, the less it triggers that anxiety. So we want to not just avoid these anxiety-provoking situations, and want to go out of the way to challenge ourselves now that we have some of these skills. You could do that exercise we just did with noticing thoughts without resisting them. That's almost, in a way, could be thought as an exposure to thoughts. The thoughts, next time you have them, if you do this exercise, will seem to trigger anxiety less because you just notice them come and go and have a way of doing that now. You may expose yourself to a situation. If you just have panic attacks near, when you go up an elevator, people gradually expose themselves more and more to that situation. And again, sometimes that can be helped with a counselor. It can also be helped with just your imagination and closing your eyes and imagining yourself pushing the button to go up in an elevator, and imagine getting a surge of adrenaline and telling yourself, great, having an energy burst, and feeling that adrenaline go through your veins. Exposure to physical sensations is another thing people do to deal with anxiety. They can play with the sensations of panic by intentionally hyperventilating. And you can even do it for 10 seconds to get a feel, and then start feeling a little funny and go straight to diaphragmatic breathing. So it'd be like, feeling a little funny, and just enjoy some diaphragmatic breaths. And then if you worked with a counselor, you might do something even more intense with that. Keep in mind that practice is important. The more we practice on these strategies of being mindful, the more our brains can actually change, the connections to our brains can change and make that mindfulness easier and easier, and make us deal with anxiety in a better way. Things you can practice, you can just go to the session of that exercise I did, and you can listen to that exercise we did in this video on a regular basis. There are 14 free exercises on my website, audio exercises at stressremedy.com. Just click on the audio tab at Stress Remedy, stressremedy.com, and then again 14 exercises you can listen to on your phone or your computer. The one exercise probably closest to the one we just did here is called the letting go exercise. Sometimes I'll call it that, sometimes I may call it non-resistance training, or this whole thing non-resistance training. There's other free audio exercises on mindfulness at UCLA MARC, the UCLA Mindfulness Awareness Research Center, and also at the UCSD Center for Mindfulness. So let's just review things. The first thing I want to review is a panic attack is not dangerous. It can be scary, it's not dangerous. If you do not fuel the panic attack by resisting it, a panic attack is usually short-lived and less intense. For now, allow any physical sensations to be present without resistance. Instead of calling it a panic attack or anxiety, label it an energy burst and just feel the useful energy flow through your veins. And you can pick out your favorite analogy. That could be Tarzan, a superhero, Popeye. Whatever it is, just feel that energy flow through your veins. You can work towards changing the future. We should. But as you do so, remember the present can only be as it is, so accept the present as it is. You don't have to believe or resist all your thoughts. Remember that diaphragmatic breathing throughout the day and focus on the sensation of the abdomen expanding with one full inhalation and relaxing with the exhalation, and focus on non-judgmentally enjoying other sensations throughout your day.
Don't go out of your way to avoid anxiety-producing situations. Assume the attitude of wanting some adrenaline in your day and wanting opportunities to practice the techniques you've learned. And when you practice the techniques, don't do it with the attitude of trying to reduce anxiety. Practice with the attitude of acceptance and fully getting into how you're feeling right now.
And then follow up with a counselor and or your healthcare provider if needed. And if you do so, make sure all of your questions are answered so you really feel confident in whatever on your diagnosis. If you have more questions, please explore my website, stressremedy.com. There are a variety of resources on the site, including those free audio exercises I talked about. There's videos there, there's various links. There's information on my book, Relaxation on the Run, Simple Methods to Reduce Stress in Seconds. There's information on my speaking, which I do for a variety of groups. And I also teach classes in Santa Barbara for Sansom Clinic, and they're offered free there. And I'd like to take this opportunity to thank Sansom Clinic for offering my class on stress reduction and also a wide variety of other classes that are free or low cost to patients. And they have a variety of patient education for the entire community in Santa Barbara County. If you have questions about those classes, there's more information on the website, sansomclinic.org. I wish you all the very best. Thank you so much for spending this time with me, and I really hope that it has been useful for you.